Welcome to Everyday Health Guide. If you're ready to take back control of your health, today we are going to talk about how to quit smoking for good. 1. Why quit? Smoking damages nearly every organ in your body. It increases the risk of cancer, heart disease, stroke, and lung problems. But here's the good news: your body begins healing within hours of quitting. After 1 year, your risk of heart disease drops by 50%. The sooner you stop, the better your chances of a longer, healthier life. 2. Step-by-step guide to quit smoking. Step 1. Set a quit date. Pick a date within the next 2 weeks. Mark it on your calendar. Mentally prepare yourself for that day. Step 2. Identify your triggers. Is it stress? Coffee? Social events? Knowing what makes you crave a cigarette helps you prepare better responses. Step 3. Find your reason. Write down why you want to quit, whether it's for your kids, your health, or your finances. Keep that list visible. Let it remind you why this matters. Step 4. Get support. Tell friends and family. Join a support group or talk to your doctor about tools like nicotine patches or gums. Step 5. Replace the habit. Chew gum, take a walk, sip water, or do deep breathing when the cravings hit. Keep your hands and mouth busy. Step 6. Reward yourself. Saving money. Use it to treat yourself, a massage, a dinner, or something fun. Celebrate each smoke-free day. 3. Final encouragement. Quitting smoking isn't easy, but it's one of the best decisions you can make. Stay patient, stay strong, and don't be too hard on yourself if you slip. Every day without smoking is a victory.